Welcome, everybody. Welcome to our telephone town hall meeting. Thank you so much for joining us tonight. We're going to be on for the next hour with Mayor Williams. There's a bunch of other people, experts in their various fields, here to answer your questions and really fill you in on this particular pandemic. Now, if you have a question, the best thing to do is to press 0. That's 0 on the keypad on your phone, 0 if you have a question, and press 7 on the keypad on your phone, 7 if you want to provide us your email address. With that email address, we will keep you up to date on matters. It's probably a good thing to press 7 and get that email address in if you haven't gotten an email address into the city already. So again, let me say this a couple of times while we get more neighbors on the call. Welcome to our telephone town hall meeting. Thank you so much for joining us tonight. We're going to be on for the next hour. If you have a question, please press 0 on the keypad on your phone, 0 if you have a question, and press 7 on the keypad on your phone if you want to provide us your email address for email updates. We're going to, the city wants to keep you up to date on matters now and into the future, so we need that email address to do that. So it's 7 for that and 0 for questions, and we really appreciate your participation on especially getting those questions in, because we got a lot of experts on here to answer your questions. So we hope you'll take us up on it. Now I'm going to bring on the mayor. Mayor Williams, go ahead and take it away and start us off if you would, please.
Well, good evening and welcome to this Tele-Town hall meeting. And usually we conduct the Tele-Town hall meetings in individual council member districts and open the topics up to anything on our minds of our residents. Well, because we know so many of you are concerned about the coronavirus pandemic, we have decided to have our first ever citywide Tele-Town hall meeting that will be dedicated to answering your questions about the coronavirus. I've assembled our top experts in our community to answer your questions. And joining me is our fire chief, who oversees our Emergency Operations Center, Mr. Don Krausen. We have our city manager, Trey Yelverton, Police Chief Will Johnson, Michael Jacobson, the president and CEO of the Greater Arlington Chamber of Commerce, and Dr. Cynthia Simmons, the city's medical director, who has an extensive background in emergency medicine. We are all there to answer your questions about the virus, like how is Arlington combating the spread of it, the impact the virus is having on our community, the Stay Home, Work Safe disaster declaration the City Council and Tarrant County have issued and how it works, and how Arlington is working with our small businesses to help them during these tough times, and the resources out there to bridge them through this, and other resources out there to help people who are struggling during this time. And speaking of that last point, I want everyone to know how important it is for us to reach out and check our friends, family, and neighbors. Social isolation is a critical component of the effort to stop the spread of the coronavirus, but it can leave behind some of our most vulnerable, and we can't let that happen. In fact, we want to help tonight. And if you are a senior, a disabled resident, or someone else who is unable to leave your home and do not have someone who is regularly checking in on you, please press 1 if you would like for someone to call and check in on you. Now let's start getting your questions, and the process is easy. You can choose just to listen to the conversation, or you can pose a question. And we appreciate you participating. And let's take our first question and press 0 for those questions.
All right, and we have some questions queued up already. I just want to remind everybody that that if you are a senior, a disabled resident, or someone else who is unable to leave your home and do not have someone who regularly checks in on you, do press 1 now on that keypad on your phone. We will get back to you, we promise. Okay. Our first one's going to be, let's get it queued up here. It's going to be Dorian. Dorian, welcome to our call. Dorian, go ahead. This is going to go to Trey. Go ahead with your question, please.
All right, thank you. Hello, Mayor Williams. When speaking to the audit, have non-essential workers who may not be receiving pay and therefore not being able to pay their utilities and could have their water or electricity shut off, has that been discussed, and has it been discussed to waive those payments until it's safe for them to get back to work? Are you open to raising that issue when you speak to him?
Dorian, this is Trey Elverton. I'm the city manager. And yes, we have put guidance out along those lines. We are not shutting anyone's water off currently for non-payment. We would encourage you to contact our water department customer service area and arrange for a payment schedule, but continuity of services is something that we're going to maintain for the near future until we can get everybody stabilized.
let's take another question right away if we can. It's Holly, and this question is going to Chief Carlson. Welcome to our call. Go ahead with your question, if you would, please.
What defines a non-essential business?
Say it
Thank
a
you,
little
Holly.
bit louder, Holly. Holly's question is, what are the essential stores that will be open or closed? What defines essential? That's the question.
Thank you, Holly. This is Don Krausen. I'm your fire chief and director of emergency management for the city of Arlington. That definition is a rather broad definition, and you can find those definitions on our What City website. But these locations are generally locations that provide food and essential citizen services that are needed for our daily activities to essentially take care of the things we need to take care of, the essential things we need to take care of. So if you would, please go to the city website and you'll find those lists of services there, along with an explanation of what those services are.
Bree has a question coming up next, and the question goes like this. She wants me to read it. So, will Arlington provide information on how many people have confirmed COVID-19 positive by zip code? For essential workers in Arlington, will a letter be sent out to employers to emphasize the importance of social distancing in places of employment? And this is directed to the doctor. Doctor, go ahead, please.
Thank you, Bree. This is Dr. Cynthia Simmons. I'm the health authority for the city of Arlington. And the answer to your question is we don't report by zip code. We do report within the city because, as you well know, this virus is unique to a certain area of town that can spread throughout. And so we don't report those by zip code. We report by city and by county. And that's how you'll receive those numbers. And then the second part of that was you asked about information to employers, essential employers, about social distancing. And while we're not independently sending out those letters, we are very clearly communicating that through many avenues of social media, through our website, through informatics, through a lot of different areas that are available within the city that those employers can refer to learn more about social distancing.
Thank you. Okay, I want to implore people, if they would please, press 7 on the keypad in your phone, 7 if you want to provide us with your email address so we can give you email updates, especially during these trying times. So it's 7 on the to give us your email address. We have some folks standing by for that. Meanwhile, Nikki's question is for Trey, and I'm going to bring Nikki live. So, Nikki, welcome to the call. Nikki, go ahead with your question, please.
Hi, I just wanted to get an update on what's going to happen in regards to evictions that have already been put into place.
So, Nikki, this is Trey Yelverson, city manager, and we've received direction from the state of Texas that evictions right now in all cities are put on hold. We would encourage you to communicate with your property manager so that you can work to make alternative payment arrangements, but as far as evictions go, between now and the end of this month, April 30th, everything is currently on hold, and if there's any extension of that, there'd be direction coming from the state of Texas. So communicate with your landlord. That's always good to do so they know where you're at and what the challenge is and what your payment plans may be, but you can trust in the fact that you will not be evicted during the next 30 days.
Thank you for that. All right. So I'm going to bring Steve on now if we can, and let me mute that just because there's so much static. So Steve is going to be next. I'm going to bring up Steve, and if we get comments from the chief and the mayor for Steve's question, that'd be great. So Steve, welcome to the call, and Steve, go ahead with your question, please.
Thank you. Rather than a question, I actually have a compliment. Based on the statistics for the disease, as I understand them, for Arlington and for Tarrant County, we're doing really well. And I want to thank and commend the leadership we have. You'll be expected to take the hit when things get bad, but while things are good, I want to commend whatever it is you're doing that's keeping our statistics low. Thank you.
Chief, why don't you say something first on that, if you would, followed by the mayor, if we could, please.
Steve, this is Don Krausen, Fire Chief. Thank you very much for your very kind comments. I can tell you that your first responders, your firefighters, your ambulance medics, your police officers are out there on the front lines doing a wonderful job, all there, eager to serve, and the way we're handling the issue with communities, just been a real proud moment for my organization, I know the police chief's organization, and the city as a whole, and we feel fortunate to be very well supported by our city leadership team, and we're in good position to deal with this issue right now. We're just praying that it stabilizes and we can return to a state of normalcy, but thank you very much for your very, very kind compliments.
Steve, we are so thankful for our first responders and our medical professionals that are on the front lines working for us, but I want to add something else. This is a situation where all of our citizens, we are not powerless. We have an opportunity to make a difference, and I think you are. You know, so many of our citizens are cooperating with the stay home, work safe, and following the social distancing. We do hear instances where they're not, but overall they are, and that's the Arlington way. You know, we have that can-do spirit, and we do cooperate. And I just need to ask, this social distancing is so important, and we need to continue to work on it. And follow these restrictions, because then we have a chance to get out of this sooner rather than later if we follow the guidelines that have been laid out for us.
We're going to take Shirley right now if we can. Shirley, this is going to be for the chief. Shirley, welcome to the call. Shirley, go ahead with your question, please.
All right, this is Shirley Adams. Hello, Trey, Mayor, and Chief. My question is that there seems to be that dealing with this COVID-19, there are three buckets: testing, containment, and mitigation. And I'm wondering about the testing availability in Arlington. I see the drive-through testing that's available, and so we don't have data. We have some data on the ones that have been tested and found to be positive, but what I'm hearing is assume that everybody's positive till you find out otherwise, and that this is an evolving kind of a rolling wave. I'm hoping that it doesn't get certainly any worse, but it sounds like it's not over till it's over, and it always says plan for the worst but pray for better is what I do. And I'm wondering if we know how many hospital beds we have, how many ventilators, how much PPE equipment we have. Have we identified empty buildings that could be used in case there is a distress on the hospital and hospital?
Chief, why don't you take a shot at what Shirley's saying, please?
Shirley, those are all great questions, and I'm glad to see you're paying attention. It really warms my heart that you're concerned about these things, and we are too. In fact, we do track the hospital beds, we do track the ventilators, we track the surge capacity of the hospitals. We're very informed that we have a very close relationship with all four major hospitals in Arlington Memorial, MCA, USMD, and Baylor. And we have a very close partnership, and they are working with us on a daily basis on those numbers. I can tell you now that currently in Arlington, we have very good capacity, and our COVID experience is stable. From a testing perspective, widespread testing has not really been available yet. Most of the testing right now is going towards symptomatic individuals and first responders, but we do expect in sometime in the near future that widespread testing will be available for the greater community. Thank you for the question.
Let's take Manuel next. Manuel, and this is again for the chief. Manuel, go ahead with your question, please.
Hi. First of all, I want to thank you guys for this opportunity. It's really great that we can ask questions of you guys. My question is that like a lot of UTA students, I have roommates who are under separate leases. Is there anything that can be done if say one roommate keeps breaking quarantine, goes out all the time for non-essential, just based on what they say, and they just keep coming back, and the risk of getting infected just gets higher and higher?
Manuel, this is Don Krausen again. I think the reality here is we're depending on the community to come together and comply with these needed follow-through measures to keep us all safe. You can be happy to send us a message, and we'll look into it for you, and we'll connect with UTA and see what we can do from an education perspective with the students that are still there on campus or near campus. So I would just ask that you encourage your roommates to pay attention and be part of the solution. And we'll follow up if you have an individual issue for us to review. Thank you.
Stephanie's next, and Stephanie, this is for Dr. Simmons. Stephanie, welcome to the call. Stephanie, go ahead with your question, please.
Hi, I just wanted to know if you have an actual count of actual confirmed cases in Arlington versus not just Tarrant County, but in Arlington City itself. And
go ahead with that
question.
Yeah, I'm sorry.
Hi, Stephanie. This is Dr. Cynthia Simmons. And yes, we do. We're keeping track of the number of cases in Arlington. And currently, as of today, we have 46 cases in the city of Arlington.
Let's take Dina's questions for Chief. Dina, go ahead with your question if you would, please.
Hi, this is Dina Stoop, and I just want to know what I can do to help first responders on a volunteer basis, phone banks, grocery shopping, whatever, because they're away from their families, and I would like to help as much as possible. Arlington has been very good to me, and it's time for payback.
Dina, this is Don Krause, the Fire Chief. That's a very generous offer. If you want to send us an email or call us at 817-459-5500, we'll talk to you and see if there's an opportunity for you to fit in the solution. We'll provide you that opportunity. Thank you for that offer. Very much appreciated.
And this question is to be read from Michael. Can the virus stay on money or on coins? Doctor, I think that's a question for you. What do you think?
Sure, this is Dr. Simmons again, and it is possible that it could stay, particularly if it is able to stay on hard surfaces, particularly if you take coins and put them in your pocket and it's warm and hot, it is possible. The question is really not so much as is there enough virus that would stay on the coins where it would be transmissible. I think that's probably a better question to answer is the amount of virus that actually stays on money or coins something that's going to transmit the virus. And that's much, much less likely than is there any virus present. So hopefully that helps, Michael. I appreciate the question.
All right, our next question is for the Chief. It's from Victoria. Victoria, welcome to the call. Victoria, go ahead with your question, please.
Hey, good evening, everyone. My question is, I'm a mobile dog groomer, and my question is not just for me, but other grooming small business owners who actually have shops as well. I'm curious if we're allowed to work in business as long as we follow the city and Tarrant County guidelines. As well, I'm curious as to Governor Abbott's new order that he just placed in effect today. Does that affect us as a small business owner as well, being a dog groomer?
I'll tell you what, I'm going to give you my phone number to call, and we're going to research this a little further with the governor's new announcement today. We want to compare that to our current rules. So I'm going to give you my phone number to call, 817-459-5500. Ask for me, Don Krause, Fire Chief, and I'll get you an answer tomorrow morning. Okay?
Do we want to have any input, anything right now if we can? We haven't had a lot of questions for the gentleman who's here from the chamber. Would you like to step up and put in any comments at this particular time? I feel like you've been a little bit left out. Go ahead, sir.
All right, yeah, this is Michael Jacobson with the Greater Arlington Chamber of Commerce. Obviously the last several weeks have been devastating to many of our businesses. And the thing that I share with our members from a chamber standpoint, it's just not our members, it's any business in Arlington. Our goal right now at the chamber is to provide you resources to help mitigate that impact. It's important that our governmental officials and our medical community take this time to ramp up to be able to support the needs that COVID-19 has created. And while this is taking place, what we're trying to do is again, give information, resources, and tools that people can use to mitigate the impact. So whether it's how do I get an SBA disaster loan, or how do I use what was in the phase 3 of the stimulus package for payroll protection. So providing those sort of resources to the business community, as well as bringing things like how do I work in a virtual environment, and providing tips. And so every day at 1 o'clock on Facebook Live, we have something going on to inform the business community. So our key is just getting those sort of tools and resources out there and supporting our businesses the best we can in what is, no doubt, a devastating period of time.
Michael, this is Mayor Williams. I just want to compliment the Greater Arlington Chamber because they have opened this up to all of our citizens. They are not just limiting it to their members, and they have had some great Facebook Live and great tips there for our business community, but even us as citizens. It's a great website to tune into, and their Facebook Live has been so useful.
And I would say this too, just to tell you how in sync the city is with our business community. The city's website, and you can go onto the city's website and you can link on a resource for business, and they have links to the chamber and to downtown Arlington and the CDB, and you name it. They've got great tools, and we're working closely together to make sure that we're providing answers that are needed by our business community.
It's probably a good time, Mayor Williams again, it's probably a great time to go ahead and put in that I know that all of us are hungry for information, especially local information that has to do with us. We just mentioned the Chamber's website. Well, the city's website and our social media is where you can find great facts and information about what's really going on, and it is an awesome source for you in all different ways, and we're going to continue to be putting out pertinent information for working at home, staying at home, what's the latest in what's happening with the coronavirus here in our community, and then also even how some of the federal and state actions relate to us. So please tune to or go to our website, and then also find us on Facebook or Twitter. It's all out there.
Thank you, everybody. Let's take Andrew next. And Andrew, this is for Dr. Simmons. Andrew, go ahead with your question, if you would, please, and welcome.
Hi. My question relates to the logistical mathematics of the whole situation. If we have tested less than 1/3 of everybody in the U.S., we basically have to, at this point, wait for 330 million or so more test kits to be produced, then distributed, then administered. Then everyone must wait 2 weeks in quarantine in order to preserve the integrity of the whole process to make sure that it doesn't spread. The length of time for all of this to occur, how is that even logistically possible? How will we ever make it to the end of that time tunnel?
Thank you for your question. It's really a good one, and let me explain a little bit about this. So we currently aren't testing, nor is it recommended to test people that are asymptomatic. And the people that we are testing, as the testing capacity increases, are the people that are symptomatic. And so as we test those people, you're correct, we find the virus in people that are symptomatic, whether they have it or they don't. And then if their test comes back positive, those are the people that are put in an isolation period so that they don't spread the virus any further. In terms of your question for time course, what we're really looking to do is slow this virus down. It's here, and we can't get it to go away, but what we want to do is slow down that transmission between person to person. So that's the reason for asking people to stay home if they're sick, and certainly to stay home if they have a positive test result. By doing that, we hope that we can have other things develop, things like treatments, medications, things like having our hospital capacity increased by lessening the burden on our hospitals, and ultimately a vaccine. And of course, there is mad and fast and furious vaccine development that's ongoing worldwide to try and create a vaccine so that we can really limit the spread of this as much as possible.
Let's take another question right away if we can, and it's going to be from Andrea. Dr. Simmons, you're up to bat again. Andrea, welcome to the call, and go ahead with your question, please.
Hello, Dr. Simmons. This is Andrea Jacobs. I'd like to say thank you for all your hard work. And that the question I have is, when will multiple testing centers be up and running for large-scale mass?
Thank you, Andrea. Yes, that's something that a lot of people are concerned about, and I've heard a lot of questions with regards to that. There is testing capacity that is increasing as we speak. There are multiple laboratories that are coming online. There's testing capacity not only within the hospitals, but now within private laboratories, within clinics. And soon, Abbott Laboratories has actually mentioned and developed a point-of-care testing that can give results within about 15 minutes. Those tests right now are being first distributed to the areas that are very hard hit, so New York, some of the areas like that. But we expect that we are seeing an increase day by day, and we expect that we will continue to see that in our area. Thank you.
Thank you. Jessica, this is for Trey. Jessica, welcome to our telephone town hall meeting. Jessica, please go ahead with your question.
Hello, and I would just like to thank you guys for letting us join the call and ask our questions. My question is, for the people who are considered essential employees, how are we going to be able to, with the increase in our work schedule, be able to help our children advance to the next grade and to do their schoolwork, whether online or through an app? But by the time most of us get home, it is too late. Our children have gone to bed, and we are not able to continue to help them continue their education, whether through babysitters or otherwise.
Thoughts, please, on that, Trey?
Yeah, I appreciate that question. Just a couple of thoughts for Jessica. As it relates to child care in particular for essential employees, Arlington has worked really hand in hand with Tarrant County and the City of Fort Worth in partnership with Child Care Associates. And they have stood up a website that is all about child care. It's referred to as let's see, where did it go? Best Place for Kids. www.bestplaceforkids, and the 4 is the number 4. It identifies all the available child care that's available for essential employees, and as of yesterday, there were about 7,000 slots available for child care services. As it relates to educational resources, I know that the city's online library capacity is really robust there for homeschooling tools and such like that. So I'd encourage you to check out the city's website under the library services area. Lots of learning tools to assist your children. And I know for kids that are both in the Arlington Independent School District as well as Mansfield, a lot of online tools, Microsoft Surfaces and iPads and Chromebooks are being sent home with kids so that they're able to tap in to the online schooling that's going on offered through the school districts. All those are great resources for hopefully you and your children.
Thank you for that. Let's take Stevie next. This one's for Will. So, Will, welcome to Stevie. Stevie, go ahead with your question, please.
Yes, I have a question. Are tickets being given out to people that don't have a letter from their employer that they are an essential employee?
Thank you, Steve, for your question. This is Will Johnson, the police chief. The broader answer to that specific question is, with these declarations of disasters, they are legally enforceable laws that can be enforced to make sure that there's compliance with the regulations that have been established restricting people's movements. With that said, it's also stands in stark contrast with just kind of what people know to be their constitutional rights and kind of the normal American society. And so what we're trying to do from a law enforcement perspective is to ensure that people are educated about the requirements that are being passed, to be educated about the whole of society approach to try to beat this pandemic and work together collaboratively as a team in order to address this public health issue. And what we're seeing is large degrees of voluntary compliance when people may not know all the changing aspects of the law. Earlier in the call tonight, somebody talked about the governor reissued, update, and revised information even today. And sometimes that's changing day by day and hour by hour. And we've got an obligation to make sure that we try to do all we can to help educate people. That said, if somebody is clearly and defiantly violating the statute, it is enforceable, and it's not only enforceable by a citation, it's enforceable by confinement in the county jail of up to 180 days.
Thank you for that. Pearl's question is going to be for the Chief. Pearl, welcome to the call. Pearl, go ahead with your question if you would, please.
It's me again?
Hi, Pearl. Go ahead, please.
Yes, I'm 88 years old. My husband we're all in the 80s.
I'm going to read Pearl's question because her audio is just a bit off. Do we have testing centers in Arlington, and where are they? I think we asked that before, but let's ask again. Go ahead, please, Chief.
Hey, thank you, Pearl. It's Don Krausen, the Fire Chief. And to follow up on what Dr. Simmons said, there's no widespread testing available in Arlington. However, if you feel ill, you should contact your doctor. Your doctor could arrange for a test for you. If you feel seriously ill, you need to call 911. We'll certainly respond to your home and assess you and determine whether or not you need to see your doctor or if you need to go to a facility. So from that perspective, most of the testing in Arlington is predominantly for symptomatic individuals as we encounter them throughout our community. So I hope that answers your question. Thank you.
Mayor, we're going to have you answer Vic's question if we can. Mayor, Vic, go ahead with your question for the mayor, please.
Yes, good afternoon. First of all, thank you for holding the meeting. My concern has to do with people that are hoarding supplies from grocery stores for mothers. Not that addressing the virus is not a first priority, but is there anything possible we could do to inform the grocery managers to hold items to one or two at the most? That way it gives other people the opportunity to purchase items of same.
Let's see if we can get that answered for you, Vic. Mayor, what do you think?
Yeah, Vic, it's a great question, and as a matter of fact, I just want to assure our citizens that we do have proper supply chains that are coming in. However, the reason you see things off of the aisles is because people are hoarding and getting more than they need. And consequently, a lot of our stores have gone to limiting one there or two, and there probably will be more of that. But the more important thing is that we need each of us to be ambassadors to share with people that it's important that we not do that, because some of these items can be very important for our citizens to be able to acquire. And so it is critical that we understand that hoarding is the problem, not the supply chain. So we need to stop doing that and just get what we need. And we are working with our stores to limit the critical items that are now being hoarded.
Tracy's question should be answered by both the mayor and Michael, if we could, please. So pick who wants to answer Tracy's question first. I'm going to bring Tracy on live. Tracy, welcome to the call. Tracy, go ahead with your question, please.
Hi, thank you. My name is Tracy Danza, and my question is, those of us who are at home, we've been laid off and we've chosen to abide by the rules and quarantine ourselves, but we're not able to get online to apply for unemployment. It says sites unavailable. Try to call, says they're not answering calls.
how do we apply for those benefits until this pandemic is over and we can safely go out and go back to work?
So this is Michael Jacobson from the Greater Arlington Chamber of Commerce. As I'm sure people here are aware, there's been a huge surge in unemployment. In the week ending, I think March 21st, 3.3 million people in the U.S. in 1 week alone. In the state of Texas, it's been about 136,000 over that same week. The way to contact to get unemployment insurance, you mentioned the two ways that you do it. There's a telephone number, which it sounds like you're aware of, and there's the online, there's the website that you can reach out to them as well. Those are the two paths. What I'll be happy to do and respond back is see if there is some other alternative that's been created to see if there's a way of getting around. You know, one of the things, and again, I'm not 100% certain with the Texas Workforce Commission, but with some places like the SBA, what they've done is they're operating 24 hours, and if you contact them at 2 o'clock in the morning, your odds of getting through are a little bit better. And I know that's not an answer you want to hear, but as far as I know, that's the answer. Now, if you are someone who has already received unemployment and you're wanting to benefit from an extension, what I hear there is they will contact you. They have that information, and if you qualify for that extension, they will reach out to you themselves for that extension. But I will see what else I can find to be of help.
And then this is probably a good opportunity, first of all, just to share that we do have a lot of our citizens who have become unemployed. And that makes it even more important on those that have jobs and are at home to be productive. Because the more productive that we can be for the ones that have the jobs, the better off we're going to be and the better opportunity we will have to rebound from what is happening to our economy. And then, of course, just to bring it right down to each household, when you don't have a job and you are hunting for work and so forth, you're going to need help. And if those others are able to keep their jobs and be productive, the more we have that, the easier it's going to be for us to be able to help the ones who have lost their jobs. So when we say stay home and work safe, we also want you to work smart and be productive there for the ones that are. And then I'll also mention for those unemployed, reach out to Tarrant County Workforce Solutions also, because we want you to be finding that job. And there are opportunities there because there are some jobs that have become available there through this where they do need more help. It's not all across the board where no one is not hiring, because there are those opportunities. But thank you for also reaching out. Just want to thank Mission Arlington and many of our nonprofits who are helping our families here to be able to provide much needed food and housing and other things that in this unbelievable time of need.
Let's take Sheila next if we can. Sheila, welcome to the call. Sheila's going to be for the chief. Sheila, welcome, and go ahead with your question if you would, please.
Hello. Well, I really don't have a question. You had a little bit of information for the lady that was asking about her children and their education. On the television news, there's also a pen pal, PENPAL, that a lot of teachers are using to help their students stay on grade level.
She wants to volunteer for first responders. What are her volunteer options is basically her question.
Sheila, this is Don Crowson, Fire Chief. And again, I never cease to be amazed by the amount of generosity in our community. That's the one thing about Arlington. We're filled with very generous citizens, and your offer is very much appreciated. If you would call me in the morning, 817-459-5500, and we'll see if we can find a place for you to contribute to the solution here in Arlington. Thank you.
Steve is for the. This is for the doctor. Steve, if you wouldn't mind, go ahead with your question, please.
My question in regards to the testing. When this first broke out, there was an age restriction as well as being symptomatic. I do understand that you're still restricting asymptomatic people, but is there still an age restriction?
Hi, Steve. This is Dr. Simmons. No, there is not an age restriction on testing, so any age can be tested at this time.
And let's stay with Dr. Simmons for Angela's question, if we can. Angela, welcome to the call. Angela, go ahead with your question, please.
Hi, thank you for listening to me. A lot of people are concerned about where to go if they just have a small physical problem with going to a doctor. Has the city of Arlington set up places of triage where it is safe to know that you're not going to be near the coronavirus? And
go ahead, please, Dr. Simmons. What do you think about that?
Hi, Angela. This is Dr. Simmons. There are actually a number of private physicians who have set up hours for people that are well and people that are sick. Particularly the pediatricians' offices have made some of them, for example, morning hours for well visits or for minor issues that are not related to COVID, and then afternoon visits for people that are related to COVID. I know other centers that are seeing COVID patients only late afternoon so that they can then use sanitizing solutions and clean the offices at the end of the day. And so there's a number of physicians that are doing that. I would recommend that you call your physician or your healthcare provider and see if they have specific times available to you based on what your issue is. And we're also available that there's a Tarrant County hotline number that can be called that would be available for you. And if you'll look on our website, that number is available for you. I apologize, I don't have it in front of me, but look on the City of Arlington website and you can look at the Tarrant County hotline number for assistance there.
Let's take another question if we can right away. Sherry, and this is for the chief. Sherry, go ahead with your question if you would, please.
Yes. First up, I want to say I have nothing but the highest regard for our healthcare providers, as my son also works at one of the area hospitals. But my question is, what would be the legal ramifications? My husband and I are both senior citizens, and should we or one of us come down with the virus, and yet we choose to stay at home and not go to a hospital since there's no real permanent treatment or cure for this, and we just choose to stay home, what would be the legal ramifications for that?
Hi, Sherry. This is Don Crowson, Fire Chief, answering your question. There are no legal ramifications for that. You have the right to stay home. In fact, if you're symptomatic and still feel well enough to be dealing with the issue, you should stay home. If you feel like you're in a state where the symptoms are too much to deal with, then you should call 911 or your doctor to get you care as soon as possible. But there are no legal ramifications. In fact, if you feel like you are ill and want to stay home, you should stay home and isolate yourself from others. Thank you for the call.
Let's take another question right away. It's Aubrey. I'm sorry, I said your name wrong. This is for Dr. Simmons. Go ahead with your question, please.
Hi, this is Aubrey Sanders, Jr. I'm from here in Arlington. My question is, now there's not a vaccine, a real treatment, so forth. If you are unfortunate enough to come down with the virus and self-quarantine and recover from it, are you susceptible to catching it again afterwards?
Aubrey, hi, this is Dr. Simmons. And the answer is probably not, but it's really not known. I'll give you the background on this a little bit. So most people who catch this virus do well. They recover. And so that's the vast majority of people, is that they recover from this. Well over 80% that who catch the virus will recover. There are antibodies that are developed with that. And it's clear that if you do potentially catch it again, the second time may not be as severe. It may be a lot more milder case. But this is a new experience for all of us, and so some of those questions our scientific community are still investigating, and so that's one of those ones that they're still working on.
All right, let's take Tira next. Tira, welcome to the call. Tira is for the chief. Tira, go ahead with your question, please.
Hi, I'm just trying to find out. I got a food for my home, and I'm just trying to find out if it will be wise to move or should I wait, a period or what.
Tira is approved for a home, and she wants to know if she should wait until this blows over, basically.
Tara, this is Don Crowson, Fire Chief. I think that is a decision you'll have to weigh personally. Certainly, if you feel like you're in a situation where you feel like you could potentially be exposed and social distancing would be an issue, then you'll have to factor that into your decision. Otherwise, you can move. I mean, that's part of an essential element in a person's life, and that certainly is authorized. But that decision would be best weighed based on your personal situation. Thank you.
Pat is for Dr. Simmons. Pat, welcome to the call. Pat, go ahead with your question, please.
Yes, this is Pat Swihart, and my question is for the medical personnel that I see on the news is some of them have shields, some of them don't. What about safety glasses?
Hey, Pat, this is Dr. Simmons. So the important thing with eye protection is that you want to have it cover all of your eyes. So you want it to cover the front and the sides and underneath your eyes. So the answer to your question is yes. In a lot of healthcare facilities and some areas are using safety glasses as long as they cover the eyes completely. Actually, I've seen in one healthcare facility they're using swimming goggles to cover the eyes. That can actually, anything that covers the eye completely and will not allow germs or anybody to cough in your eye or sneeze in your eye or get any body fluids in your eye, that can protect your eyes. So good thought.
Doctor, we've got another question from you. It's from Donna. Donna, welcome to the call. Donna, go ahead with your question, please. Hi, Donna. Go ahead, please. You're up live. Go ahead with your question, if you would, for Dr. Simmons. I bet she has herself on mute. Happens all the time. I'm a home health worker. How can I go about getting tested for the sake of my clients?
Hi, Donna. This is Dr. Simmons. What I would recommend is that what's really more important than testing is observing your symptoms. If you're a home health worker, it's really important that you're aware of if you are symptomatic, meaning if you're having a cough, if you're having shortness of breath, if you're having fever. We recommend for healthcare providers that they take their temperatures twice a day to be aware of what their temperatures are running. And if you have a temperature over 100.4, then you should be staying home. And a lot of home health workers have chosen to wear just a simple face mask. That's up to them, but certainly if you're working in an environment like a retirement center or a nursing home or a long-term care facility where the risk is high for those individuals, if you have access to a face mask, then that would be advised as well. But more so than testing, really knowing your symptoms is vitally important.
Thank you for that. Let's take Dave for the chief. Dave, go ahead with your question, please.
Yes, first of all, I want to thank you guys for everything you guys are doing, the first responders that are out there and the police department, so thank you again for everything. The question I have really has to do is, I manage a business here in Tarrant County, and it's an essential business, and today alone I had 2 employees admit to me that they had 2 different agencies pull them over to provide the documentation. In Arlington, which one of the occurrences was in Arlington, are you guys pulling over people to show documentation, or are you guys only doing that for routine other violations, like traffic violations? What are we doing today?
Hi, Dave. This is Will Johnson, Police Chief. I can tell you that question has come up numerous times in the community, and we've spent a fair amount of time researching where these contacts are taking place to be able to answer questions just like the one that you posed. I can tell you that from our experience, I've yet to find any example where a police officer has actually pulled somebody over for the sole purpose of determining what their nature of the travel was that they were engaged in. And more times than not, the individual has been pulled over for some other traffic violation that is taking place, and in the course of the traffic stop, the police officer may ask them, where are you coming from, where are you going? Those are kind of normal questions that we ask on all traffic stops. Certainly, we appreciate and understand the fact that those simple questions that are kind of routine for us might take on a different light right now as people are really focusing on what essential businesses are and are they legally permitted to be out moving to and fro. And so specifically, that's kind of contextualized to the question. And then specifically to your question about it in Arlington. I've directed my employees, our police officers, that we're not going to stop people solely for the purpose of determining what their nature of travel is. But certainly, if we stop them for some other legal purpose, an officer may ask you what you're doing and what activity you're engaged in while on that traffic stop.
I'd like to just add to that. This is Trey, the city manager, and I've received a number of complaints in our office about, with the low traffic, about how much speeding there is in town right now. And there's a lot of people that have a freedom to go quite faster than normal. And we will still stop people for going too fast, particularly in these conditions. And then, as the chief indicated, it may be part of the conversation about where you're going from and to. But please be safe out there. While there's so much fewer cars out, we still want to make sure we are abiding by all the other traffic laws and being safe.
Thank you for that. Let's take Joe next if we can. Joe, this is for Chief Krausen. Joe, go ahead with your question, please. Joe, go ahead, please. All right, I'll read the question myself. If somebody dies of the virus, how will funeral arrangements be handled if we can't congregate in large groups?
Joe, this is Don Krausen. Funerals can still continue, and in fact, people can attend those funerals as long as they pay attention to the social distancing protocols, staying 6 feet away from each other. That still can occur. Thank you for the question.
Krista, Chief again. Krista, welcome to the call. Krista, go ahead with your question, please.
Hi, this is Krista. Hi, can an Arlington resident leave the county and work in a different county that is not under a stay-at-home order?
Okay.
Krista?
Krista's question, it kind of faded. Can Arlington residents work outside of the county with the stay-at-home order in place?
Krista, this is Don Krausen, the Fire Chief, Director of Emergency Management. The answer to that question is yes, you can. Thank you.